I'd like to thank colleagues in the university for giving me the privilege to come and talk to you today. I think you have the beginnings of an exciting research-led series of programs here that will hopefully lead to a number of new initiatives and innovations. I'm going to talk through some ideas and present to you some of the new phenomena that is taking place on the internet. And I'm going to begin, for those, in case not everybody knows, this notion of what Web 2.0 means. I think I'm a little critical of the notion. Sometimes I think it's more to do with a marketing ploy. But I think the term is used to signify an underlying shift in the World Wide Web, in the internet, and in particular the way that users, the people who use the information as opposed to those who previously perhaps published and wrote and controlled the information on there, become the central component. I think we are all consumers and producers within Web 2 internet sites, as I'll come on to demonstrate. This is just another way of sort of thinking about what is the difference between perhaps e-health 1.0, just because everybody else talks about it in this way, and maybe e-health 2.0. So it's about the way that the content changes, it's about the way the content is placed on the internet, it's about the possibilities of how we access it. In a sense, if you want a crude summary, and this is a very crude summary I want to say, perhaps in the past it was mostly the domain of experts in terms of producing content. You had to be able to do some programming, or you had to have access to the right kind of technologies. Today, it's the province of everybody. It's the province of bloggers in the audience. It's the province of people using social networking sites. This is the same thing, but it looks prettier. It's a nice little graphic, and as you can see, the kind of marketing hype here, coming from San Francisco, of course, is that we have suddenly lots of people, so it becomes a more exciting and interesting place to be. And of course, for us in terms of health, we suddenly have new opportunities to reach and interact with this audience. So let's look at some examples. I'm going to talk about some of these things briefly. Some of these might be very familiar to you. Some of these might be new. So I'm going to talk about social networking, podcasts, wikis, blogs, something called Second Life, which some of you might be familiar with. One of the interesting things is that all of this technology, all of these things that used to clutter up my life and my desk and home and work, I don't have them anymore because all this data lives on the net. It all lives remotely. I don't need any of that. Social networking sites, I'm sure many people are familiar with here. Typically, social networking sites like MySpace or Facebook, groups that can be used. And within these groups, what do we find? We find people organizing and interacting within groups around chronic healthcare problems and issues. This one happens to be about diabetes, so you have people sharing information, giving advice to each other. These are ordinary people who have this particular diagnosis, and they are talking to each other in a way perhaps similar to some of the work that was done previously under the earlier version of the web in terms of news groups and that kind of thing. And now this is moved to this more interactive forum of social networking sites. Everybody can contribute content, and one of the things we know that the demographic on people who are using these sites are younger people, people under the age of 30. Often that very set of the population that is difficult to reach for promoting health and other kind of healthcare issues. Indeed, there are also some social networking sites that are specifically organized around older people. For example, Saga Organization has a social networking site dedicated to users over the age of 50. Podcasts. Podcasts, what are they? They're cheap, they're portable, anybody can create one of these kind of things. Johns Hopkins University in the United States, for example, podcasts some of its lectures, both to its students and its public. You can find this freely available. It's easy to find and use. You can listen to these things whenever you want to. And of course, we have to remember that not everybody has good eyesight, not everybody has good degrees of literacy, but podcasts, listening to the radio, which is the equivalent of this, can therefore be an important channel for communicating information to them. Wikis. Wikipedia, of course, is something that I try hard to explain to my students who are all learning to be doctors, that the answer to all their questions is not in Wikipedia necessarily. It might be in a medical textbook, but they like using Wikipedia. Wikis, anybody can create wikis. This is one that is created around issues to do with flu, influenza, and it has a lot of information on there, both contributed by healthcare professionals, both contributed by ordinary people. It's easy to use. People can learn a lot on these. They can search for terms and things. However, because it's open, rather like my warning to my students, sometimes you get information that's incorrect or misleading. So it depends on the wiki, depends on the level of moderation and the purpose of that. Blogs, I feel everybody is familiar with. I have an illustration from a very prestigious blogger, Paco here, who's in the audience. It's easy. I have created a blog, and I will do a better job after this meeting. You don't need any space. It's not very technological. If you go to Blogger, you can do this in a few minutes. It's easy to read and write information. And you begin to make connections. People find your blog and start to read your blog. They start interacting with you, interacting with your social networking site, and so on and so forth. Second Life, I don't know if people are familiar with this. I personally find Second Life a little bit boring, but I'm the wrong demographic. It is a, they don't like you calling it a game. I met the people who started this when I was in the States last year, and they see it as a virtual Second Life. So you create a little figure, these little avatars, and this is an example from the University of Plymouth in the UK. It has created an island and a house with a library full of health information, and here they're leading a discussion with these people about matters to do with sexual health. So they're experimenting with this as a way of delivering information about health to the kind of demographic that likes using the space that is Second Life. So there are some themes running through this that I think are worthy of attention. This is about user-generated data, data created purposefully and consciously, or indeed sometimes unconsciously. Wherever you go on Web 2.0 sites, software kind of tracks where you've been. When you go to Amazon to buy a book, for example, it makes recommendations that other people like you who bought this book might have liked this book. That might be good for you. So you didn't ask for that information. It is there by the nature of your interaction with the system. Users are central to this, and increasingly and importantly, it can be accessed through mobile devices. We no longer need to use a laptop. You can get it on your mobile phone, on your PDA, on your mobile PlayStation thing. So if there's some themes, I want to shift a little bit and talk briefly about this phenomena of, I think, what we need to recognize as a new cartography, a new mapping. How are some of these possibilities being used? Maps. Maps are great. They make complicated data much easier to understand. Previously, maps were expensive. They required costly equipment. They acquired expertise. But since 2005, we have detailed global maps that include satellite and other geographical kind of projections through Yahoo Maps, Microsoft's Virtual Earth, Google Maps. I would have liked to have shown you this live, but I wasn't confident enough in my ability with the technology to do this. We call something called mashups, which is a musical term, comes from hip-hop music in the United States, where they take different tracks from different pieces of music and put them together to create something new. And what what's happening here, what is an important phenomena of Web 2.0, is that people take data that is already there for some other purpose and mash it up in a new form to create something new. So let's look at some examples of this. This is something called Health Map. It tracks the reports of new disease outbreaks. You can see from the interface, you can make various choices. It takes data directly from PubMed, for example, from newspaper feeds. You can display it. This is an interactive map, so you could zoom down just onto Barcelona if you wanted to. You can have available here as real-time information about these diseases in the same way the World Health Organization has. Suddenly, the public has this depth of information, and you can do quite a lot of statistical work on this if you wanted to. Completely differently, this is a website called Who is Sick? It seems somewhat appropriate to me that it's based on in America, on Los Angeles, and what happens here is these little circles indicate people who have self-reported feeling ill. So you register on the site and you enter in your zip code so it knows where you are, so it can put you on the map, and you say, I have a bad headache today, I think I have a cold, and it is reported on the map here. Now, you might think to yourself, that's strange. I wonder if anybody else living or working there where I am has the same symptoms. And you can look on this map and it will tell you. I think it's an interesting example. The medical sociologist in me knows this as a visualization of the symptom iceberg. In other words, these are all the symptoms that we never know about because people don't report them to the doctor, so they don't enter into our statistics. This is the feeling of unwellness. There is a slight flaw that I should draw your attention to, in that if you go to the site, I think probably still any of us could pretend to be in this particular country. So, yeah, I don't know how accurate the data is, but I think it's an interesting indicator of the kind of things that people do. Okay, so is crime a health issue? There's a debate in public health in the United Kingdom, as people might be familiar with, about issues to do with people living in high crime areas, and that coincides with very high reported instances of ill health. So we're beginning to worry about crime as a health problem. In the United States, in some states in the United States, and indeed Poland and other countries, the public have right of access to daily or weekly crime reports. These crime reports are available on the internet. It's very easy to mash these up, geolocate them because they're geolocated by postcode in the United States. So you can look at your city, your street, and you can see pretty much a daily or weekly update of the crimes that are committed. You can click on the little tags and you can get further information from them. Interesting. Well, you can't do that in Spain, you can't do that in England because the public don't have access to that kind of information. Okay, so in Brazil, what somebody's done at the university there is they've created their own crime map. And again, rather like the sick web page we saw, people here report their own experiences of crime on here in a similar way. So you can put on there that you had your bag snatched, your wallet stolen, it's geolocated in a similar kind of way. So this is, for criminologists, the kind of hidden shadow of crime suddenly visualized for you. Again, user-generated data, you notice. Many cities have pollution monitors. Sometimes these pollution monitors deliver direct information to the internet, so the live instrumentation will be reported to websites so you can see the level of bad pollutants, whether it's pollen or industrial pollutants in the atmosphere, around the location of these individual polluting monitors. So this could be very useful because it might shape where people choose to live or work, if they have asthma, if they have allergies. But location matters. In Japan, for example, you can register and you can receive on your mobile device, that happens to be a mobile phone, if you're walking in a street and you're going to enter an area that has pollutants of a kind that might affect your asthma, it'll tell you, and you might need to take an inhaler dose or just avoid that area. So in other words, we're beginning to see the movement of this data in almost sort of real-time ways that can shape how people interact and move about the city. Now, this could be very liberating for somebody who is concerned about movement around an urban space because of their medical condition. A further phenomena that I think is interesting is user review sites. User review sites are sites where individuals write their experiences of particular places or particular books or particular items for others to see. This is TripAdvisor, which I recommend to anybody if you want to take a holiday. It's very worthwhile looking at. This happens to be TripAdvisor of the hotel that they were kind enough to allow me to stay at. And as you can see, very positive reviews here. And you can display this in sort of various ways. People like these user review sites. In America alone, this got 7 million visits in 1 month. And this site surveys hotels and resorts across the globe. What about health service? What about health service rating sites? We're interested in how our citizens, our consumers, feel and think about the services we provide. In the United Kingdom, partly funded by the National Health Service, there's a website called patientopinion.org. It is available so that patients or users or citizens can write comments about their hospital, about their clinic, about the service they've received, gives them advice to others like, I would recommend you do not go to this clinic early in the morning because there will be queues, that kind of thing. And this data is taken from other places on the internet. They didn't put the data there in terms of creating the spaces for the hospitals and things. They use that and it provides the frame for people to put comments on, and you can perhaps see some of the comments that people have written on there. Interestingly, individual hospitals and clinics can subscribe, pay a small amount of money to keep this service going, which is run by a general practice doctor. And for that subscription, they automatically get fed user comments to the relevant manager in their relevant hospital, and sometimes you can see that that person has replied saying, well, thank you very much for your comments, and I'm glad you had a good service, or things went wrong for you, maybe this is why. So interesting issues about public and citizen engagement and accountability. They do things differently in America, of course. In America, there's a number of review sites. RateMD.com is one of the more prominent ones. This site draws data off the internet to make the site. Every doctor and every institution, it's possible to search for them by name on here. The doctor's name is here. This is an example of a doctor based in the United Kingdom. The site is started in the United States. It's now possible to look at reviews from Canada, India and the United Kingdom. So what I think is interesting about this, we have individual Dr. Smith, and people have written comments about good or bad experiences with Dr. Smith or Dr. Jones that is searchable. They rate them on a kind of star rating, where they think their 5 stars are very good, 3 stars are not very good. An interesting phenomena, I think, I would also perhaps like to share with you that, of course, there is, and indeed, from the same company, one that rates your professors, which you might enjoy looking at. There are a number of other of these sites, most of them based in California, partly because of Silicon Valley is there, so you have that synergy. Secondly, United States law enables users of this site. It has been established that if you own the site, you are not responsible for the content that other people put on the site. Now that's important because in France, for example, last year, they had a site that children were able to write comments about their teachers, and exactly the similar way. So you had teacher Smith, a student could write comments, and the teaching unions took that website owner, which was based in Paris, to court, and the site was effectively closed down. The education minister said that it was impossible and they welcomed the court decision. So you can't do this kind of site based in France. Of course, Rate the doctor site, there's nothing stopping that putting French doctors on there, so the French public would have access to it. So We know health, I think, is a commodity. We buy it, we worry about it in terms of our health and fitness, what we eat, what we consume, how we look after ourselves. In market-based healthcare systems, I think it's about the way that health products and health services are directly marketed to consumers. And if we make choices based on review sites, maybe we'll have greater trust in that service. There is a sense we know a lot about the service before we actually go there. Or in the case of America, we know a lot about the individual doctor. There may be problems. If you're a particularly popular or highly rated doctor or service, you'll get a high demand, and how will they be able to manage that? What is the impact on the doctor-patient or perhaps doctor-consumer relationship? How does that change the nature of trust and faith that patients often like to have in their doctors? Indeed, doctors would like to think their patients invested in them. Are we sure everything on these user reviews are actually true? You could make it up, and indeed, if you were a doctor or a professor on one of the professor rating sites, you could write really nice reviews about yourself. There are ways they do to stop that, but and how? How would you feel, or how would I feel, if I found myself on one of these sites? And you wouldn't know if you were on one of these sites. You'd have to go looking. It could be part of empowerment. We are concerned about empowerment. This is a commentary out of the English Parliament, where they talk about the underlying philosophy of e-health is to empower the individual to look after her own health in the most effective way. There's much talk about expert patients, informed patients in the UK. We expect patients to look for information through the internet, through telephone services that the National Health Service provide. The degree to which consumer patients make choices, maybe this will be based and validly based on these kind of user review sites. Okay, so perhaps some more themes here. Software and other materials located remotely. So Web 2.0 information, as I say, is mobile. It can be accessed anywhere on any kind of platform. It is also global. Castells, of course, has talked about network society, and this is a good example of it. RateMD, based in California, but it could have and does have professionals who are rated on there from the UK, Canada, and possibly Spain, Portugal, and other places. These websites attract a social cost rather than an economic cost because they're not expensive, in contrast to the previous kind of web pages, to put up and maintain. They're costly in social terms, and they work because people put their own data on there. They contribute, they do the labor, if you like. However, we must remember that everybody is, or indeed wants to be, connected to this. There is a digital divide which is changing, though more people are becoming connected. But in particular, we know that older people, perhaps people living in poverty, may be outside this, either voluntarily or because they cannot afford it. I think it highlights the need to provide small groups of people, for example, those that are old, with special services, to encourage them to use these kind of information services, to provide ways they understand the computer and things. There's a network of these schemes in most countries. I'm concerned that what we don't want to do by moving information to these mediated forms to reinforce established patterns of exclusion in health. We want to address those rather than reinforce them. I'm concerned that we don't make those people who are privileged in terms of money and resource and access to this information even more privileged by their choices they make on here. We need to make it more egalitarian. I think there are many opportunities that we have. Web 2.0, simple, cost-effective. We're publishing information. We can target some traditional hard-to-reach groups. For example, sexual health information to young people through social networking sites, or Second Life, within languages that they can easily understand, within local languages and circumstances. That's easy to do. We can help people choose services. We can help them find medical service where they live through map-based technologies and visualizations. We can engage with the public and actually our own staff, because people are scattered around in different institutions and things. We can distribute information through blogs, through podcasts, through wikis, so on and so forth. We can place the user at the centre of our service provision. What are demands on us? I think we have some new demands and expectations on us as providers and educators. We need to make full use of the opportunities afforded for our patients and our public by Web 2.0, because if we don't do it, they'll probably do it for themselves. It's already been indicated by the crime map, perhaps, by who is sick. If the provision isn't there, people now increasingly have the ability to do these things for themselves. We need to provide high-quality information through whatever means. I think we have to welcome and make productive use of user-generated data. We don't need to be afraid of the users having a much more central role. We need to recognise we have new ways of communicating and quickly communicating with the public and with other people. We can enhance the promotion of health and the quality of healthcare service. I think that's my kind of overall ambition for these kind of resources. So shall I do something dangerous and make some predictions? Predictions are always very dangerous, of course, so I'm carefully flagging that in the past people have made predictions such as Popular Mechanics Journal, 1949, it predicted that computers in the future weigh no more than 1.5 tons. I'm not going to carry one of those around with me. Or the chairman of Digital Equipment Corporation, which at the time was a major provider of IT, there is no reason anyone would want a computer in their home. Well, actually, maybe you're strangely right, because we will now have the computer in our PDA, in our mobile phones, so actually maybe we won't want a computer in our home anymore. So my predictions are mobile devices. They will become the major platform that people connect interactively to these services. This has already happened in Japan, so I feel I'm fairly safe grounds here. Health providers will use Web 2.0 to communicate with citizens because it's faster, better, more interactive, and the demand is there for them. Health information becomes more personalised. We saw that with the example of the person with breathing difficulties being warned of data dedicated to their circumstances. Maybe we're getting too connected though. Maybe we'll have our doctors prescribing disconnect holidays because we're getting too obsessed with our social networking and our email. So I'm happy to take questions, perhaps to both of us. And finally, in case anybody wants any references or anything, these are some general places that you can find information about some of the phenomena I've talked about. And right on